pleased to see you all. I'm Christine Lenehan. I am Director of the Council for Disabled Children and really pleased to be with you this morning. Amanda suggested I'd chaired this morning partly to cheer me up because the world at the moment can feel quite challenging. You know, there is a lot going on. There is a lot of uncertainty generally in the world out there. And there is a fair amount of uncertainty in the world of SEND as the review is delayed and as we look forward to what the next iteration of that might be. But one of the things we've been talking about as a team this week was actually one of the things we are really, really privileged to do is spend a lot of time with stuff that's going well. There is some excellent practice in SEND. There is some really good innovations going on, some really important innovations going on, both in the teams themselves, but also in the learning we are able to take from working with the generosity of the people who will present today, so that also we can support other areas in their development and what they do. And I'm really, really pleased that Rochdale and Camden are here today. I know how hard you've both worked to get to the services that you want to show, and I'm really grateful for you taking time this morning to share your journey, its ups and downs with other people. So that's the purpose of this morning. We're going to hear good stuff. And you're going to be given an opportunity to ask questions about that. And again, because we record this, you're going to get the opportunity to share it with others and have a think as we go through about what you're hearing today might help you in your own service development. So we're going to start with Amanda. Amanda's going to do as a sort of brief about what integrating services feels like from a Council for Disabled Children perspective before we go on to Rochdale and Camden. Amanda, over to you.
Thank you, Christine. And I will be brief because mostly what I'm talking about is a report that is of some age now. It's at least 3 years old, but I think it still sets a good frame for the conversations that we're about to have. And I think I just kind of wanted to reflect before I started that this feels like a really good time to be talking about integration. In fact, lots and lots of different bits of government policy are flying at us, different reviews and the health and care bill, all kind of exhorting us to integrate and collaborate in order to provide more effective services for those that we work with. And I think what we sometimes see is great leadership of services, but siloed leadership. And therefore, you know, because we don't work with children and young people who are siloed, they tend to creep across different boundaries. That then can sometimes mean that actually the services that we end up with aren't as effective as they could possibly be. Like Christine said, we are one of the reasons we are delighted to be able to put this morning on is because we wanted to share the joy really. When I worked with Sarah on the Camden case study, I just felt really privileged to have had the opportunity to understand the work that had gone on and the journey that Camden had been on, and it did honestly feel like a privilege to be able to do that. So to be able to share that with a wider audience felt really important. And Anna Gardner and I and another colleague were in Rochdale virtually on Tuesday and listening to some of what Charlotte and Steve will tell you later on this morning. And I can honestly tell you that we were all welling up because of how exciting it was. Just to see the vision and the energy behind improving services for disabled children. Again, a real privilege that we wanted to be able to share with you. And so, but the other thing I just wanted to say before I started is that I know sometimes when you see people who have gone on that journey and are achieving those kind of things, it can sometimes make you feel as though you couldn't possibly get there. But I hope that the way in which they talk won't make you feel as though they're superheroes, you know, who, you know, and in a different league, but just inspire you to think about, as Christine says, how you might be able to achieve the same thing in your local area. So next slide, please, Marie. So we produced this report. It takes leaders to break down silos, and the aim of it was that there's a fair bit of literature out there about, you know, this is our constant moan about adults and how you integrate things for adults. Very little around children, and very little around children with SEND. So we worked with 3 local areas and talked to 76 people within those local areas to understand what it was that helped and what it was that hindered them with integration. Next slide, please, Marie. So why is it so important that we integrate things for children? So these circles partly came, they came from one of Christine Lenehan's ridiculous drawings. But also sort of from a report by the Children's Commissioner in 2018 that talked about those kind of multiple and overlapping vulnerabilities. And too often when we respond to those vulnerabilities, we respond, you know, as specific services and not thinking across those services. But if you look at that Venn diagram on the right, you can see that there is such a significant overlap that, you know, actually we've got 57% of looked after children who have SEND. So if we don't think about those things, you know, within a system in an integrated way, then, you know, we will absolutely be missing some tricks. Next slide, please, Marie. So what did we find? There's going to be a massive surprise for you. Any of you who have read any of the Ofsted and CQC reports, what helped integration was good leadership, but also good data and information sharing. One of the things we've really seen when we've worked with local areas on our data dashboard is how good data brings areas together and really helps people to understand, you know, that they are talking about their children, if you like, and not somebody else's children, not somebody else's problem. So what also helps is where other change programs reinforce the integration message. So if you're getting, you know, if you're getting exhortation from somewhere else and maybe even a little bit of money, then that really helps. And sometimes creativity forced by resource constraints. I mean, that one might sound more uncomfortable, but actually sometimes we're less good at sharing when we've all got enough. And sometimes not having quite enough forces us to think more creatively about it. The things that hinder us, you know, kind of the opposite of those. So lack of leadership, having different data systems, different, you know, not being able to share data, not counting numbers in the same way, all that sort of thing. And also the siloed way in which the government introduces change programs. So very often in local areas, you know, you've got you know, it feels like stop, start or stagger. You know, you're all focused on one thing, and, you know, and that's got that set of KPIs, and then the game changes and you've got a different set of KPIs and something else. And I think the thing that strikes me from the work that we've done with local areas where they've set themselves a very clear vision and a very clear strategic direction for where they want to get to, is they're much easier for them to insist that that government mandate fits within their strategy, their clear sense of direction, and they don't get pulled and pushed in quite the same way as they do when they don't have that clear sense of direction and they're sort of running around, you know, trying to meet that mandate. And fragmentation doesn't help. So hopefully the SEND review might do something about this. We live in hope, but local authorities struggling to influence schools and that academisation, you know, lots and lots of people feeling as though they don't necessarily have the levers that they need at the point at which they need them. Next slide, please. So government enablers and obstacles. So national policy where it provides clear directives and accountability that are aligned with local areas priorities. That's kind of speaking back slightly to what I was just saying. And I think the work that we've done around implementation science sort of very clearly shows this as well, that, you know, especially where national policy comes along with the money to implement it, you know, and can be fitted into local priorities, that makes a massive difference. What doesn't help is pressure to implement change within tight timescales, lack of join-up between government and local authorities, and in fact lack of join-up sometimes between government departments. So national operating targets that don't align between services and inconsistent government direction. So, you know, I know that a lot of people feel that, you know, and certainly we are, you know, quite upset about the behaviour agenda right now, you know, and don't feel that that really helps with the, you know, the inclusion agenda, or the idea that we should be working towards schools being able to hold more pupils and being able to meet more need at point of presentation. Next slide, please. So resourcing issues. So the numbers of children and people with complex needs has increased. That's another report we did, by over 50% between 2004 and 2017. So there have been a number of things that I think we have had to, or when I say we, that's the real we, you have had to deal with, that hasn't necessarily been sufficiently in government sites. And funding cuts. Local authorities have seen a 49% real-term reduction in government funding over a similar time period. And allocation of resources. So funding, especially within health for children's services, is often tied up in block contracts and all age spending. So actually it's quite difficult sometimes for commissioners to distinguish or direct that spending for themselves. Next slide, please. So the role of leadership, and I will speed up a bit because I don't want to go over my time, because I do want you to mostly hear from other people. So strategic leadership is the most important factor in enabling or hindering integration. So local leaders, and we've seen this, it's been a lot of our work over the last couple of years, is supporting local areas to achieve that shared strategic vision. And we have found that it has been incredibly powerful in bringing a local area together and working out what is the contribution of their service and their budget towards achieving the goals that they want to achieve for children, young people in their local area. And also then helping them to think about whether or not they've got that commissioning piece right, and whether they need to be doing something different. So really, really important there. Next slide, please, Marie. I've said that, so you can move on again. So data and information sharing, again, incredibly important. It does show the big picture. It identifies gaps and pressure points. It helps a collective response, and it helps to make sure that that services are delivered in an integrated way. So it's really important that professionals have timely access to data, helps them to give the right advice and support, and it can help to facilitate and coordinate packages of care. So really, really important. And we know that there are some challenges. We have been giving the Department for Health and Care, social care, a big we've been beating them up about the fact that the health and care bill does not do enough around data sharing for children and young people, because we don't think it's easy enough at the minute. But we do know that lots of local areas actually have done masses around this. And one of the things that Charlotte and Steve will probably talk about is the JSNA that we've worked on with them. And they've really managed to get a really good and clear picture of what life is like, and the different data around disabled children in Rochdale. Next slide, please, Marie. So challenges, measuring impact in a meaningful way, and I think you'll get a lot about possible solutions to that from Sarah's presentation. So, how do we make sure that we're not just measuring widgets, but that we are really measuring the difference that we make? We're doing some work with the Midlands region at the moment around information sharing, so we will hopefully have something to share about that in September. But definitely at the moment that really getting in the way for lots of local areas. Next slide, please, Marie. And the last one, so I'm doing all right. So making it work, joint commissioning agreements. So using that outcomes-based accountability approach, so making sure that you know where you're trying to get and you can measure the journey towards getting there. And I won't say anything more about Camden and Rochdale because you will be hearing from them. Joint working arrangements. Hi, Steve, no worries. So joint working arrangements. One of the things that we did find when we did the report that we did was that some of the good things about formalising things and having either contracts or, things like Section 75 agreements is that so many of you are brilliant at building relationships and making things work and coming to agreements either around specific children or around specific services. But there can be a real danger then when staff move on of actually, you've got somebody new coming in, doesn't understand where that came from, why they should be putting that money in, doesn't understand the business case that sat behind that, and then sometimes that leads to a breakdown then in those agreements. So their formality is really important, and involving families in decision making. So really making sure that strategic direction is co-produced with parents, and that they feel as though they are on that journey with local areas. So that was all that we wanted to say, just to sort of frame the discussion. I'm really looking forward to the rest of this morning, and sitting back and just hearing from a couple of local areas who I think I have done and are doing some amazing stuff. So over to you, Christine, to introduce them.
Thank you, Amanda. And yes, Charlotte, Steve and Sarah, I'm sure you're feeling very confident you're going to live up to the star billing. So don't let her put you off it. This is actually about understanding where you've got to. But I am also really interested and excited to hear your journey. So Charlotte and Steve, over to you, please.
Thank you. I'm feeling a bit nervous. I don't usually get nervous, but I'm feeling a bit nervous after that build-up.
Yeah, blame Amanda. Don't worry about it.
So I'll introduce myself and I'll hand over to my colleagues to introduce themselves, and then we'll move on with the presentation. So my name's Charlotte Mitchell. I'm the Head of Commissioning for Children and Maternity in Rochdale, and my post is integrated across the local authority and the CCG. I also have a hat for the SEND lead for Greater Manchester as well, for supporting the development of our spatial planning for the GMICS, which I just think it's important to add that frame, and the work that we're also doing with Tracy Hart. So I'll hand over to Steve first.
Hiya, I'm Steve Kay. I'm the Assistant Director for Early Help in Schools for Rochdale. So all things education, early intervention and support, and SEND are also within my portfolio as well.
Thanks, Steve. And Vic?
Hi, I'm Vic Thorne. I'm the Divisional Director of Nursing and Allied Health Professionals in Rochdale Care Organisation, which is part of the Northern Care Alliance. So I manage the Children's Community Health Services part of the locality, which does also include SEND in my portfolio from a health perspective.
Thank you. So Steve and I are going to present today, but Vic's here for any questions at the end of this, and we very much work in partnership in driving this agenda forward. Next slide, please. So our slides aren't really going to give you, I guess, a guidebook. They're not going to give you a full plan of how we implement this, and it's very much that we are on a journey. But what we wanted to share with you today are the principles that underpin our work and the vision that we have and how we're driving this work forward. So I'm taking you back in history a little, just to kind of give you a flavour of Rochdale and who our people are. So Rochdale founded the co-op in 1844, and it's got a philosophy that's built upon its customers, everyone owning things together in that common pursuit for not for profit. So we work as one, and we challenge adversity. We are an area of significant deprivation, but our people are strong and resilient, and we're friendly, and we're proud, and we do things differently, and we very much have a relational approach which underpins everything that we do. And I think that's really important to say, because that is that's driving this work. That's the kind of water under our boat moving forward. So we're working on the philosophy that we've got a DNA that's founded in social justice, that it takes a whole community to raise a child, and that this absolutely needs to be underpinned by engagement with our people. And we're very much working in partnership with our parent carer Voice, and we're very fortunate to have Kath Bromfield, who is a national advisor in Rochdale as well. So we feel we've got the kind of core ingredients for a good team. Next slide, please. So our vision is really that in order to move forward with this agenda, we have got a mission to make SEND everyone's business, and the steps that we'll describe are supporting us in doing that. We need to move away from EHCP being the only thing that is associated with SEND, and we need to think about a whole system response, prevention, early intervention, how we're wrapping around children early, supporting them where they are in those neighbourhoods, as well as a specialist offer. We need to move away from diagnosis without support. We need to support before diagnosis, so it's how do we develop our services to achieve this. It's how we embed self-help and resilience in our families so that they can manage. Many families want to manage on their own, and they're quite happy to do that, but we need to give them the skills, the information, the education to be able to support them in doing so. Our success will be determined on lived experience of our children and families, and this underpins everything that we do. But I think at the minute it's providing an opportunity for us to do things differently. We've got no option than to do things differently. Our data is telling us that things are not going to get better unless we change things, and we can only achieve this with that whole system response. So we've got a climate of open possibility that can only be built upon a currency of our common endeavour in achieving that. And our key questions to ourselves are, how do we create the conditions to realise the above, and how do we take our wider system with us? Next slide, please. So I think many of us over the last year have begun to think about a perfect storm, challenges in a number of areas, number of services struggling. So are we in a perfect storm? We have rising requests for EHCPs. We know we have a cohort of children 18 to 25 that are going to require intervention and support moving forward. We know that there is a significant correlation between SEND, EHCP and deprivation, and we know that our society is struggling. So if you look at Rochdale from a deprivation perspective, we are an area with significant deprivation, and we have significant pockets, and this does link with the SEND agenda. We also have got a change in culture, we've got a change in shift, we've got a reform of NHS policy, which is happening midst a pandemic. So, you know, there are some quite challenging things that we're having to balance. Next slide, please. In addition to that, we know that our children, with regards to development, there are significant reductions in the number of children reaching the milestones at the ages and stages questionnaire, so at 2 years old. And we also have significant increases in referrals to occupational therapy, speech and language and physio over the last year. And the trends for occupational therapy and speech and language have increased year on year. Next slide, please. From a mental health perspective, we know that whilst we haven't seen significant increase in referrals locally, we know that the complexity of our children is increasing. So we have seen, and these slides probably increased over the last couple of months because we are seeing significant surges. So we have got a 25% increase in the number of contacts that children are receiving, and most of the focus has been around managing crisis, managing risk for children in quite serious distress. Next slide, please. Okay, so I'm not going to do any more doom and gloom. We're positive in Rochdale, so we're going to move forward. So you think about the challenges, you think about adversity, and you think about opportunity. So with every stage of adversity comes opportunity, and with every challenge gives us I guess a push. If you hit rock bottom, you've got to go back up. So it gives us an opportunity to think differently about how we manage this. We're not seeing COVID as that wrecking ball, we're seeing it as an enabler for change. And how do we come together in a position of a system response to respond to that opportunity? Next slide, please. So what have we done so far? I think every point within this slide could be a half-a-day workshop or a day workshop. So I just want to say at this point that we have been very fortunate. Amanda referenced earlier that having resource does support change, and this very much has been the case for us. So we've been on this journey probably since the beginning of the year. It's not a long time when I think about it. I was reflecting on that this morning. It really isn't to say how far we have come. So we have engaged with 65 stakeholders, 45 children, young people and 45 parents, and co-designed a joint outcomes framework, which we are going to share with you later on. We have been working with the Council for Disabled Children, who've been fantastic in allowing us to analyse our SEND data. It was clear when we started this journey that we did not have a clear understanding of our data, and now I think we've gone above and beyond with the information that we have. We've been ambitious with this, so we're asking for data on our vulnerable children, we're asking for data on transition, and in being ambitious, it's allowed us to have a really clear picture of need across our borough. We have looked at our outcomes and began to think about what is the change that we want to see, how do we turn the curve to success, and how will we measure ourselves against that. We're beginning to think about our data. So from a data dashboard perspective, what is it that we need to measure? How will we know the impact of this? But from a qualitative perspective, how are we going to measure the quality of that? How are we going to feel what this feels like for our children on the ground? So that very much will be part of that discussion. So we're looking at system readiness for inspection. We know there's a new framework from the autumn, and we want to be ready for that, and we want to be statutory compliant. So we're working with, again, with the Council for Disabled Children on the development of an audit to map ourselves, which will be good to share with others once that's complete. From a system readiness perspective, our system is big. So when we think about system, we think about health, we think about care, we think about children's, we think about adults. And in order to support us with this work, we submitted a bid to NHS England for some support in the development of a SEND Alliance. So we have been working with an independent consultant to help us get to a stage of aligning our contracts, aligning our leadership. And we have been very fortunate, whether it's pure goodwill, whether it's pure persistence and knocking on doors, but we have now, and we're really pleased to share this, that we have strategically positioned SEND within our local care organisation. So we are going to create a mandate which is signed up to across primary care, acute, and this is a real shift for us, because absolutely children are not always around the local care organisation construct, and SEND is really, really important to that change. And we feel that this will mobilise us into a transition agenda and that 0 to 25 agenda, but also supporting and understanding the throughput into adult care, so that it is everybody's business and everybody takes this very seriously. So in order to support all of the above, we have reviewed our governance, we are draft modelling our new system with a potential go live date of September. So that's where we are with the SEND Alliance. Next slide, please. So we have a golden thread. We feel that where that thread is being weaved in across our entire system, and we're in the best place that we've ever been. But that golden thread must be built upon the 3 principles and the things that we mentioned above. So it's around moral purpose. You know, it's around this being important, this being everybody's business. It's around treating every child as you would your own, and there being no wrong approach to us meeting the needs and flexible care. It's around joining up, it's around pooling our budgets, pooling our resources, pooling our leadership, but also distributing that leadership across the system, because we know that the system will be destabilised if everybody doesn't lead this agenda. So it's that collective vision across our local area. But most importantly, and I think our privilege in Rochdale, is our collaboration with parent carers and children and young people, and the breadth and the knowledge and the passion that they bring to this agenda allows us to move forward. Next slide, please. So our shared vision, and this is our collective vision, and this would underpin our strategy. So we are also in the process of developing our 5-year strategy for SEND, but that will be dependent on the action plan that we develop over the next couple of months. So we will support and enable children and families to be healthy, happy, stay safe and achieve their true potential as value members of our Rochdale community. We will recognise where we need to develop and learn together. We'll celebrate progress and success, and we'll build on what works, focusing on providing collaborative support when and where our families need it. And that is our vision. And the picture in the slide is, the bottom one is our Rochdale Riverside complex, which is a beautiful complex that we have, and that was what was there before. And I think maybe that's where we were at the start of our SEND journey, and this is where we hope to be. So our vision is very clear for Rochdale. Thank you. I'm now going to hand over to Steve, my colleague, to move us on. Thank you.
Hiya. So whilst we've been doing all of that, we're also thinking about the alliance in a much broader sense, and thinking about outcomes, and thinking about Charlotte's talked a little bit about the changes within the health sector, which have been really important. The education sector, the whole shooting match is a constant moving feast, isn't it? So we had You know, we have maintained schools, special schools, academies, this or that, and all sorts and shapes and sizes, which is important. It gives us lots of opportunity, but also presents us lots of challenges. So I was given a list of grumbles a number of months ago from primary heads saying these things are wrong with SEND. What you know they went to, we have 8 collaboratives, so they went to each collaborative and said, what do you think's wrong with SEND? And then they presented them to me to fix. And I said, you know, I really take this seriously. I'll absolutely work through all of them, but I'm not going to do it. I'm not going to present you with the report. We can do it together. And you know, and we can really make some progress. So so that opened up a dialogue really helpfully, and so it's that kind of, we've got to own our own communication practice, we've got to own our relationships, we've got to own the issues collectively, because they're not individual service issues or organisational issues. It's whole system, and it's got to be about outcomes for children and families, not just about a service-centric perspective to what's actually going on. We've also have, so that's with the primary schools. I'll come on to that in a little bit. We've also started some work about a year ago, about beginning of the year actually. We have an organisation called the Pioneers Trust, and the Pioneers Trust is basically all of our secondary schools, maintained academies, and also our post-16 colleges. And they come together as the Pioneers Trust, and they were at a little bit of a crossroads, you know, environment changing, what's happening, and you know, where do we go now? We started to talk about the very, very important building block of vision and values. It's got to start with vision and values. It's got to start with the exam question of what's our common moral purpose? Why are we doing what we're doing? Why did we become public servants? Why do we do what we do? And so we've started that dialogue, and it was really, really powerful. And it set us off lots of challenging and interesting conversations and dialogue. Ultimately, coming to the place of, right, we need what's our common moral purpose? We need a plan. We need a strategy. What's our vision? And they come up to, you know, everyone came up together with this concept, which is I would describe as a thing of beauty, which is raising Rochdale. So the concept of raising Rochdale, which is around, as Charlotte said, it takes a village to raise a child, but also raising Rochdale in the sense of our aspiration for children and families. And that is the Pioneers Trust's gift to the system. I'll come more onto that, but they've really started down that track. Also, what we've done is thought about our governance in relation to, you know, if people are actually going to own it, they need to be involved, they need their skin in the game. You know, we need to be able to move forward together. So we have a really active now and energised inclusion board. There was one particular, head teacher, very vocal around inclusion, you know, banging the table, you know, banging the drum, really active. So I approached her and said, thinking about setting up this strategic inclusion board, how would you feel about chairing it? So she's like, all right, yeah, well, okay. So she's chaired it. We have 5 primary heads, 5 secondary heads, number of colleagues from post-16 and also senior local authority officers actually saying, right, what's our plan? What's our vision? How are we actually going to engage? And then that connects to the Pioneers Trust and also Rochdale Association of Primary Heads. So what we're doing in terms of what Charlotte's discussed and what we've discussed here is we're basically creating the strategic conditions for future success, actually enabling or creating the framework and the scaffolding to enable this to exist. So next slide, please. So we also have our Children and Young People's Partnership, interagency partnership, right across all senior colleagues who are involved in the work of children's, also parents and carers on as part of that forum. Really clear, as you can see there, vision and priorities. All children and young people achieve their full potential in Rochdale. 2 basic priorities. So there's a clarity in terms of where we're actually going with our Children and Young People's Partnership. And I suppose what we're doing as part of this presentation is we're connecting the strategic dots right across the system. So next slide, please. As part of our inclusion work that we're doing, as you can see here, we had some external support. We have an inclusion review. It was stalled as a result of the pandemic. Rochdale was hit quite badly and continues to be so. So that's put a stall on some things. But the inclusion board I've just mentioned is basically gripping this work and moving things forward. So, it's further identifying gaps, weaknesses, really thinking about our vision and strategy for inclusion. What do we mean? And tackling the really knotty issues. Thinking about our culture, our approach, our use of language. What are we doing in terms of educational provision? You know, really getting into it. And our inclusion strategy is beginning to do that. So next slide, please. So in terms of the inclusion board itself, so thinking about all of those things, but then ensuring that, you know, because that the inclusion board sits and reports and has the school's input really heavily, but then thinking actually inclusion is it's not just a Pioneers Trust issue or a primary heads issue, it's a system issue. So we've placed that inclusion board as basically the system board to actually deal with inclusion, and that can report to the Pioneers Trust, to the Rochdale Association of Primary Heads, Children and Young People's Partnership, the Safeguarding Board, wherever it needs to, but actually the inclusion specialists are basically gripping that work and thinking about always encouraging getting into the detail of the strategic alignment, and are we actually, whatever we're doing, is it making the boat go faster? And if it doesn't, why are we doing it? You know, is it a group that actually reports somewhere and is on a pathway to future success, or actually is it a group of people having a conversation and they're in a cul-de-sac and not on a pathway? So we just need to think about that and challenge ourselves all of the time. So next slide, please. So could you just press that there's some, yeah, that's it. There's various badges. So in terms of the schools and colleges that are actually involved, secondary to post 16, as you can see, basically what we're doing is saying, right, okay, let's start again. Vision, values, let's start with that. And the only thing that's holding all of this together, by the way, is moral purpose. That's the only thing. Moral purpose and outcomes. That's the glue. That's the important thing. It's not a structure. It's not anything else. It's not a legal entity. It's moral purpose, and that's actually the thing that drives us. And then we think about where are we going and what's actually happening in relation to that. So next slide, please. The really important thing about this is that all of those schools individually, and obviously they have their own strategic frameworks, inspections, etc., but actually collectively they've not had a strategic plan before. They've now got one, and it's a single plan about Rochdale and where they're actually going. They have a single vision and values. And also I think that, you know, we're doing more work on this, and this is another really, really important building block. How are we actually going to hold each other to account? What are our behaviours if we've got this relational approach? If we're taking moving towards an outcome-focused alliance, what behaviours are important to us? So really beginning to get into that dialogue with people and saying, and then when people go off track or things go off track or something happens or there's a challenge, it's really important to bring us back to these are our behaviours, these are our vision, this is our purpose, this is what we're doing. So very important. We're starting in earnest from September with the Rochdale Association of Primary Heads. So the Pioneers Trust with secondary and post 16 started this work, but the Rochdale Association of Primary Heads is so excited about it. And really starting full on from September. So exciting. So next slide, please. Sorry, yeah, that's it. Yeah, there's one more, I think. Yeah, so we have a strategic plan. It's really important and exciting that we've got this plan. We've got the beginnings of our comms strategy in terms of how we're actually going to engage, because, you know, you think about, you know, it's all right having these conversations, but if you're pick any one of those schools, if you're a teacher in that school, what does all this mean to you? What does it mean? What does it mean in terms of your day-to-day practice? So next slide, please. So there's seven areas of the strategic plan, as you can see there: recruitment and retention, support for vulnerable pupils, curriculum, school improvement, accountability and assurance, admissions and place planning, and building the system for the future. Now, all of those things really important as part of the plan. But what the pioneers have done, and what we've done as part of a dialogue with them, is say, right, okay, so that's all important. So what are your priorities? Your priorities, and the priorities that they've come up with are support for vulnerable pupils and curriculum. And I'll talk more about what that actually means in a second. So next slide, please. So vision and values, they come up with a value statement there. I won't read it to you, but you can see it there. And then also in terms of what they're about, the building structure in terms of what you can see on the right hand side. So leadership for change in terms of curriculum, safeguarding, inclusion, under the really solid roof of equity and excellence. And that's what they're actually about. Underneath, Amanda earlier mentioned around outcome-based accountability, and that is actually part of the framework that sits behind all of this work. Whether we're talking about the SEND Alliance or the work with schools, it's around how much have we done, how well have we done it, is anybody actually better off as a result? And thinking about that framework from the really, the lovely work that Mark Friedman has developed over the years. Now, thinking about that in terms of pioneers, what they've been doing stage left is thinking about, right, so we've got this plan, we've got our vision and values. What are we actually going to obsess about? What are we really, really going to focus on? And they're going to focus on progress, attendance, and exclusions. Now, what's really interesting as we talk about, the work that we've been doing with interagency partners, children and families in terms of the outcomes framework, in terms of SEND, those things absolutely align in terms of our obsessions. And these things beautifully have been developed independently but simultaneously in Rochdale. So what that does is creates the conditions for a whole system approach to these things. So next slide, please. I mentioned about behaviours. It's behaviours, not just values, because it's all right talking about things that are shiny. All of this sounds lovely, but so what? What does it actually mean for you on a day-to-day basis? The work on behaviours, we're really committed to it. We really do need more work. We're not the done deal. We're not saying we are, and we've got lots of challenges, but we're just sharing our approach. But the work on behaviours is so important, and this is about habits, not just intention. So warm words are lovely, but they just remain warm words unless we actually do something. So it's about doing that in context. Next slide, please. So we all bring different things to the party. All of us, we all have different. We're so blessed in Rochdale. We've got some amazing people, all of our stakeholders. So we think about, we all bring different things to the party in terms of we've now got a clearer understanding in terms of our JSNA. We've got an amazing parent carer forum. Charlotte and I meet with them every fortnight. We've started going out for dinner with them once a month. It's just dead important that relationships are at the heart of everything, because we will disagree sometimes, all of us. We will get things wrong. There will be challenges, but we've got to be grown up enough and to talk about it and work through it. We've got a shift in system culture that will continue to progress as we move forward. We're creating the strategic conditions. Charlotte mentioned about the LCO. We've got our Children and Young People's Partnership. I didn't mention actually the Pioneers Trust voluntarily are agreeing to go to public scrutiny in relation to their annual plan, which is so, they don't have to do that. It's amazing. We've got a collective energy for inclusive practice, really strong leadership right across the park. Which is just brilliant. We're so blessed. But then also, I think the beautiful thing amongst all of this is the potential of the concept of raising Rochdale from early years right the way through to post 16. And watch this space. I hope we're here next year to say, this is the difference that we're actually making. Sorry, next slide, please. As you can see here, dead important. These are the outcomes that we come up with. So my opinions are valued. I'm emotionally well. I'm as healthy as possible. I'm safe and supportive. I'm active and involved. I'm hopeful and prepared for the future. And those that care for me are supported. This is underpinned by hours and hours and hours of work and dialogue, but also really importantly, indicators in terms of what this actually looks like and how we're actually going to measure these things. So next slide, please. I mentioned about obsessions with the Pioneers Trust. So the obsessions related to the outcomes framework that we're thinking about is keeping children in education, exclusion and attendance, keeping children in Rochdale. Why do we place children out of area for either educational purposes or residential? Sometimes that might be necessary, but more often than not, it doesn't improve outcomes for children, and it shines a light, or it should, in terms of, well, what provision have we got in Rochdale, and what should we developing here? So we're going to, that was part of our obsessions in terms of being able to do that. And as you can see there from the diagram, the inclusion strategy, our alliance work, and the Pioneers Trust, and all of that work with Rochdale Association of Primary Heads. In isolation, they're nice things. Together as part of a jigsaw in relation to SEND are really, really powerful. So last slide, please. So we're on a journey. We've got our building blocks in place, but relationships and our friends are very important to us. Our work, you can see Amanda and Anna there, and everybody from Council for Disabled Children. They're our new BFFs, and we're always so pleased when we're working with them. There's such a delight to work with. And thank them so much for becoming part. We want them to move to Rochdale. I don't know how well that would go down with them, with their employers, but we want them on board. So thanks very much.
Thank you very much. I don't know. We've got staff all over the country, Steve, so you never know. Do you know what? I think for me, thank you for saying nice things about CDC, but that was the strongest expression of moral purpose I have ever heard. It's so powerful, and I think what was really striking to me was actually your first slide, Charlotte, which showed your roots as a cooperative and where you'd come from, and you can see the echoes of your history on that journey. It's really, really powerful, and you can see that in the chat you're getting questions that you're answering, and I suppose those questions, one of the things that I really liked about that presentation is we get lots of presentations that say I did this and I did that and here's a checklist and this is what we did and whatever, and they're really helpful, but in that what you just described was how we change culture. And it's the most difficult thing we ever do. When we go back and look at why the challenges happen in the system and what happened to the Children and Families Act, it's because we couldn't change culture. And I think that between you and Vic, you being a really key part of this, along with your parent carer forum, and yeah, we have a lot to do with Kath. You have some really strong parents in Rochdale, but there is something about that cultural journey, which for me is so powerful. And you can just see, I hope you are bathing in the glory of the stuff that's coming through on the chat, because I also think as well there's a real honesty. You are not there yet. So what you're talking about, as you say, is those building the alliances and that sort of length of time it takes to build the picture, to build your jigsaw, Steve, and get it there. So yeah, really, really well done. I'm meant to be looking at the chat. Amanda, is there anything else we've got to add from the chat, apart from the fact people... I
think if you go back to Lorraine's first question, that might be a good one. Maybe Lorraine could just ask it and,
good idea.
Mix it up a bit.
Yeah, okay, thank you. I think Charlotte's replied, but I was sensing as I was listening, I'm sure the CCG and the local authority do a lot of joint posts. And I think that, whilst we think that makes a difference, it's good to hear that makes a difference here. Because I guess my whole point is, how do you get the senior leadership signed up to support this agenda from the top to the bottom and everybody working? And I absolutely, this is about culture, this is about how people work together, this is about how people understand what their common vision is, what their moral compass is. It's absolutely brilliant. And I guess what makes a difference? That's what I was trying to get. You know, what are the soft things that other people are probably going, God, I'd love to do this in my place, but oh, I don't think I can do this. Our leadership isn't right, or our structure isn't right. You know, what really made the difference?
Thank you. Shall I come in with my view on that? I think it needs to be top down, bottom up. So at the same time as having integrated posts, I really value my integrated post and the relationships that I have across the CCG, health and the local authority, and I actually have joint leadership. So I'm managed by our DCS, but also by our commissioning team. And that allows me to open doors and allows me to have conversations and to be part of both teams, but from our very top. So our chief officer is in an integrated post. We're really fortunate that our new adult director of services is also integrated she's a director of commissioning, and she has a real passion for SEND. So she is absolutely supporting us on driving this forward. But what is really important for me is taking people with you on that journey and helping them design the solutions and come up with the solutions, because they're the ones who are going to deliver it on the ground and own that moving forward. So facilitation and taking those groups of people with you is so important, and that's where it's been really helpful to have independent people in to kind of take that step back and say, okay, how do we do this together? So that's my view on it.
Thanks, Charlotte.
Okay, one of the other things you've been asked, unsurprisingly, I think from Stu here, is what's it been like developing joint funding arrangements? You know, you've worked with the culture. How are you being able to handle the money?
It's a really good question, actually, because and sometimes we haven't historically done that well. So, you know, but you know, when we've got issues, for example, with therapies at the minute, you know, we've got some real tensions with therapies. So Vic, Charlotte, and I talking about that, and the pandemic has really hit. So in the local authority, we have OT in speech and language. So does Vic in terms of their services. So what we're doing at the minute, so a live example, for example, is saying we're actually we've got an agreement where we're actually saying, so we're talking about the alliance, we're talking about an outcome focused approach. Why have when we've got all of these pressures with therapies, why do we not have an integrated response, and what does that need to look like? So first off the block is going to be our approach in terms of therapies, and where we're going to be looking at that, getting somebody independently to come in. As Charlotte said, it's all about relationships. Every single bit of it is about relationships, and it's about engaging all of those therapy specialists and ourselves and everybody who's got a say in it, to say, right, these are the issues. These are the resources that we've got. How can we use them to best effect in order to support children and families? So it's about taking it a chunk at a time, I think, not banging anybody over the head and saying, look, we've got some problems. How do we address them? Where's the evidence? What do we need to do? And how do we move forward together, really? And it's also not pretending everything's fine, because it's not, and it's okay if there are challenges in the system, but if there's system challenges and we approach them collaboratively, then we find the collaborative advantage. If we don't do that, then you really easily fall into a blame culture of othering. Oh my God, local authority doing that, health are doing this, can't believe schools, and it serves no purpose and doesn't help children. So we just need to get over ourselves and actually have the grown-up conversation.
Thank you, Steve. That is really, really helpful. And as you gather from Lorraine's want to connection, therapies is a national issue. So what at the moment you're being faced with is around the country, and we have got to. It goes back to what Amanda was saying in her presentation. We are with therapies at creativity defined by restricted resources. You know, almost that's the challenge. So what is it? And I just love your positivity, Steve. That's great. I think actually that's probably quite a good introduction for Camden. Sarah, I hope you're feeling okay after all of this, but we are really keen on listening to Camden's journey, because again, it's another example of how you move from disparate to integration and what happens. So Charlotte, I like Sarah, in fact, over to you.
Thank you very much. I'm not actually sure whether I can follow that very adequately, but that was a phenomenal presentation. If we can just go back one, please. So thank you. So yeah, I'm Head of Children, Young People and Family Services in Camden. I'm a speech and language therapist by background, and I've been in the borough since I think 1992, so a very, very long time. I guess what I'm going to do is share our journey of integration more from a provider perspective, so hopefully we'll really complement the Rochdale journey. What I would say is I think we face many of the same challenges. Obviously, the therapy issue is massive for us, the same kind of increases in diagnoses and referrals. I'll tell you a little bit about Camden first of all. So we're a relatively small borough that sits within north central London, and 5 boroughs make up north central London as an ICS. We have Camden's Integrated Care Partnership within that, and the Integrated Children's Service that I'm going to talk to you about reports into the Integrated Care Partnership. Numbers wise, we have about 40,000 children under 16. They're expecting that to increase by about 9% by 2026. About 30% of our children are on free school meals, and we definitely have problems. I would say that we're absolutely on a journey where the end point keeps changing, doesn't it? But using, I hope, our good relationships and integration to work towards those. Similar problems, you know, ASD, both referrals for assessment and increasing diagnoses rates are issues for us. On a broader public health issue, on a broader public health stream, I suppose we have problems with obesity and immunisations. So it's not all rosy in the garden of Camden. I know there are some colleagues from North Central London and from broader across London here, and we know that there are discrepancies across the sector, which we're working collaboratively with the other boroughs to try and iron those out and level things up. So what we are is a service that brings together 4 NHS providers that you can see on the slide there, under a single leadership, but no single accountable provider. So my job is really to make the 4 NHS providers and the local authority play nicely together, as it were. So if we go to the next slide, thank you. Back in 2012, 2013, we were starting from this point, and it was really a little bit of a mess, but surprisingly things worked really well on the ground. So if you think from the bottom there, once the need was recognised and referral in was required, what you can see really here is children pinging all around the system to different providers in different organisations, and really a kind of sense of a lack of joining up care. If we go on to the next one, this is where we wanted to get to and where I think we are today. So visually it looks much nicer, doesn't it? It'd be really nice if it all worked exactly like that on the ground. But essentially we've moved to a single point of referral, which won't be news to many of you, but for us that's despite the fact that we have 4 NHS providers working together, I suppose. So single entry point to all services for children with additional needs and complex needs, and those referrals flow electronically into either a single service or into MDT clinics or into CAMS. And every child, crucially for us, every child or young person who requires 2 or more interventions, 2 or more therapies, will have a multi-agency or multidisciplinary care plan that is co-produced with the family. So that's one of our key things around integration, I suppose, one of the ways of demonstrating that. If we go on to the next slide. Now, I should have put the reference for this, and I believe, Amanda, it's Greenhalgh et al. From 2004, so apologies for that. When I was starting to work with Amanda, she introduced us to the concept of implementation science. I'm going to take you through these stages to map out the journey that we've been on. I have to be really honest and say that we didn't know we were using this theoretical approach at the time, and I'd really like to think we did, but actually it does map really well onto the changes that we've made. Thank you. So if we go to the next one. So if we're taking through the stages of implementation science, looking first at fertile ground. So we were really lucky. There's been a little bit of talk in the first presentation about joint commissioning, joint working together. And in many years for Camden, joint commissioning had been set up and working well. So our CCG commissioners sit within the local authority, and they have the shared budget. So that was already established for us. Because in Camden, we'd already had the 4 NHS providers on the ground for a very long time, we had that real wealth of local knowledge. And a really key factor, I think, was stability amongst the clinical leads of those services. So what we have in the borough is Tavistock and Portman, who just provide CAMS, and that's all they do. We have the Royal Free NHS Foundation Trust, and they provide our community paediatricians, our OTs and physios and community nursing. We get speech and language therapy from Whittington Health, who are next door in Islington, and CNWL, who I work for, provide some of the MDT services, so the child development team and autism work, as well as everything that's universally provided for children. And all of those kind of clinical leaders were really kind of stable and well established. Because of that, I think we were all able to see the strengths of partner organisations, and had an element of respect for each other and an element of understanding what our unique selling points and what we were really good at and what we didn't want to diversify into. So Tavistock and Portman, for example, are really clear that what they do is CAMS, and they're not really interested in diversifying into anything else. There was also a real desire amongst the different providers to improve outcomes, and everybody understood that pulling things together in a more integrated way was not only possible, but people felt we were ready to do it. We'd had, back in 2012, there was an incident in which a child was mishandled as a result of not having a care plan when she transitioned from one service to another, from one provider to another. And part of the learning out of that was that because there wasn't a single clinical record system, the safety for children was reduced, and that, I guess, was a little bit of a lever to work to move towards a more integrated approach. So we had our fertile ground, we were ready for some change. If we move on to the next one, please. Was the system ready? And we think it was. So like I've said, we had brilliant joint commissioning, and our commissioners were really flexible and ready to give things a go. It was also at a point in time, a financially different point in time to where we are now, where there was probably a little bit more resource to try things and give things a go. So an example might be that we set up the single point of referral before the integrated children's service was established, just by bringing together the 4 NHS organisations. There was that degree of trust and understanding that everybody was willing to set that up, and the commissioners gave us a little bit of money to do it. We spent, I think at the time, I was head of speech and language therapy for Whittington Health, so I was representing Whittington Health at the negotiations about how we were going to move to this integrated approach. And what I would say from my experience is that all of the providers and the local authority were really keen to see a change, and we developed the new model collaboratively, and that very importantly included the financial model. And a key factor for all of our providers was that as we moved into the integration, nobody lost out. So all of the providers kept the financial stake that they already had, which was really important for the organisations. Like I say, we spent about a year discussing how we were going to set things up and what the outcomes would be. On to the next one, please. So then we decided to make the change, and a little lever to getting people on board was that we had some reward-based commissioning at the start. And what that meant was that we set up the key performance indicators that I'll talk to in a few minutes. But it meant that if each quarter, if each of the providers met the key performance indicators, each provider would get a little bit of financial reward. But if one of the providers didn't meet a KPI, nobody got the money. And that was a really clever bit of commissioning. It wasn't a huge amount of money each quarter, but of course everybody was keen to get it. And when we faced challenges along the way, such as typically with autism assessments, and nobody got the reward money, it was up to us as a group of 4 providers to work collaboratively on that, to move things around in order to improve the outcomes for children and young people. So that was one really important factor. The second thing was that several of the providers compromised, but of course no provider wanted to lose out. I think we were probably forerunners in, you know, the kind of current model, which is collaborate, don't compete. I think we were forerunners in that, really. An example of compromise would be that CNWL, who I now work for, agreed to TUPE over a very small number of OTs and physios that we employed. We TUPE'd them over to the Royal Free, and that was so that staff could sit discreetly within professional groups. All of the organisations agreed that we needed a single electronic record for children. So the other 3 all agreed to pass on to kind of give up their information, I suppose, onto the CNWL system, with an understanding that CNWL would provide the information back to them each quarter. And that was quite a big deal all those years ago. We set this up in 2014, and we know how organisationally sensitive data can be sometimes. So that was a big leap of faith, but done very much in a way to improve the outcomes for children and young people, and most importantly, to improve safety. The other factor influencing our change was drivers coming from families. So I was really pleased to hear Rochdale's engagement with your parent carer forums. I always thought we had good relationships, but we don't go out for dinner. Sometimes we have a coffee, but I think that's fantastic. And what families were telling us across the board was that they wanted to be seen quickly for needs to be identified early. That was a really key factor for them. And we wanted to know that whatever we were offering was satisfactory to them and that it was really improving things for them. So those were 2 of the things that we took directly from our families to build into the model. So then into the implementation, I think we can probably skip this one and move on to the next one. Thank you. Our unique features. So I'll just refresh as well, because I didn't put this on a slide, but we have 4 NHS providers. Each provider brings a different element to the partnership. So like I said, the Royal Free gives us our paediatricians, OTs and physios. Whittington Health give us speech and language therapy and children's continuing care. They used to also provide dietitians, but that moved over CNWL as a collective agreement that performance really wasn't working for Whittington Health. So a couple of years ago, we made a collaborative decision to move them into CNWL because we have a bigger dietetics service. And that's another example of change done collaboratively and providers not just holding on to what they have because it's their thing. Tavistock and Portman provide CAMS, and CNWL provide what we call Mosaic, which is our integrated service, integrated with social care in a single setting for children and young people with the most complex needs. So having a single electronic record won't be a surprise to any of you, and I suppose it's just about remembering that because we had the 4 providers, when we set up the service, you would have a single child with notes on 4 or 5 different systems. And believe it or not, well, you will believe it if you know about acute trust, some of those records sitting on paper notes. So what we were able to do was set up a single electronic record that very much belongs to the child. It's CNWL's record, and that works really well because CNWL provides everything that's universal. So we now have a single record from birth onwards, and anybody working with that child in Camden uses this record as opposed to the electronic system that belongs to their own organisation. So it belongs to the child. Within that electronic record, if a child has 2 or more professionals involved, there's a multidisciplinary report. So families get a single piece of paper that has everything in one place. A shared care plan, the share is sharing it with the family. I've started to change my terminology on this a little bit because you all know about reporting outcomes and recording things on clinical systems. What I've discovered recently is when I talk about a shared care plan, lots of my staff think that what I mean is ticking the box on system 1 to say, yes, there's a shared care plan. But really, when so we're changing our narrative to say, actually, we're thinking about a plan of care, because that articulates more clearly what we're talking about. And again, for families, what that means is that they should have a single plan, even if they don't have a statutory plan, that outlines what everybody's going to do and that we all talk to each other. We also have a single outcome measurement system. So we spent about 2 years, I kid you not, going through all of the different clinical outcome systems to reach a decision about using a single tool. And I'll come on to that in a few minutes. Oh, sorry, back to the other slide. Clinical leadership spans both organisations and professions. So we have staff sitting very discreetly in professional groups, and that's part of our built-in governance. So if you're a speech and language therapist working with children in Camden, you can only be employed by Whittington Health. Even if I have some spare money, which occasionally I have, I can't just buy in a speech and language therapist. If speech and language therapy is the need, I have to give that money to Whittington Health for them to employ. And that arose out of the incident I told you about in 2012. So what we know is that then all of our professionals within a discrete group are all working to the same policies and procedures and standard operating procedures. They're all following the same safety net. The group of clinical leads who provide those staff report to me for leadership. So we have that shared clinical governance across the system, even though I don't employ them. We have shared accountability for performance and governance. We only have 5 key performance indicators, and that's the bit that I really love about the system. There's loads of work contributing to that, but we only report on 5. And what we report on is access, so how quickly children and young people are first seen. We report on feedback, so what do families think about it, and whether their confidence has improved as a result of our intervention. We report on shared care plans as a measure of integration. We report on clinical outcomes, so what percentage of our children have met the outcomes that we've set. And we look at transition as well, so looking at those very complex 14-year-olds and do they have a transition plan in place. Still loads of work to do on the KPIs, but that's essentially it. The professional leadership I've talked about and the reward-based commissioning. So, you know, things have changed over time, and I will just touch on this. So at the start, the way our governance was set up was that if we all met the KPIs, each organisation would get some reward money. Now, what we worked out very quickly was that some organisations were very good at putting that money back into the system to improve care. Some organisations would say, thank you very much, pop it in their back pocket and we'd never see it again. So we were able to bring a change in after a year or so, by which the money would come into a central pot if we achieved any money, and the providers would bid against that for clinical improvements in the system. And that was a much better way of doing things to ensure that it kept reviving the clinical outcomes we wanted for the children and young people. On to the next one, please. So this is our latest performance. You can see the first two are around accessing the system. So the average wait for children across all services is just under 4 weeks at the moment, and that's for an assessment. It's not a triage appointment or a telephone call, it's an actual first assessment. And having seen huge challenges with our autism assessments during COVID, we're now back up to about 85% of those over 4s starting assessment for autism within 12 weeks. I have to say the waits for the little ones are much longer. High numbers have a multidisciplinary care plan in place and are achieving goals, and good numbers are reporting that they like the service and that families are more confident to support their children. I put little asterisks there because I really ummed and ahed over this performance. This, as you all know, is post-COVID performance. Usually for the past 4 years, we'd have well over 90% having an MDT care plan, well over 90% achieving agreed goals, and well over 90% recommending with the good old friends and family test. What we've seen in the last, obviously, I know you've all seen the same challenges, and I just wanted to be honest about it. The bulk of the drop in these things relate to families of and children and young people in our special school, which was massively hit by COVID, and pretty much over for most of the year, therapists haven't been able to do very much face-to-face work with children and young people at all. And the staff feel very sad and upset about this, but what we're seeing is that the children aren't achieving their agreed goals, and families are saying they're not happy or not as happy as we'd like them to be. But it gives us, we know where we are, and that gives us something to hopefully work better with the special school over the coming year to ensure we can get those therapists into the classroom doing face-to-face. I think there's nothing more disheartening than trying to do a remote intervention when the iPad's fallen over in the corner of the classroom and nobody's noticed because they're busy. But that's where we're at, thank you. So if we go on to the next slide. Families generally like it. They see that we talk to each other, even though we come from different providers, and that's really, really important to me, that families see us as one, as a single service. And we had a really good SEND inspection back in 2019. I remember the inspector saying to me, if I hear single point of referral and single record system again, I could start a word association bingo or something with the number of times he heard those things, and that was from families as well as from staff. So generally people are happy. Okay, on to the next one, please. What helps it work? Just as I think Steve was saying about, this, what were you calling it? The moral, I wrote it down. Your kind of culture, I suppose. We have an alliance. Moral purpose, that was it, thank you. So we have an alliance agreement between the 4 NHS providers. It's completely not legally binding, so if somebody were to pick it apart, they could, but it stood the test of time for 6 years already, and there's no sense of changing that. Finance was a big factor, so every organisation kept the money that they already had in the borough. And I think that was really important for the providers to be able to take that leap of faith to come into this. The governance is secure, so in order for all of those staff not employed by CNWL to use our clinical record system, we have a process of honorary contracts, which not only assures us as an organisation, but allows me to assure families that the people accessing their child's record and using it are of the right integrity and standard that we would expect. And relationships has been a massive factor in this. So if I tell you that most of us have been in Camden since the early 90s, you might think we're all a bit stuffy and kind of not developing and not outward looking. And I really hope that's not the case. But I think the relationships between the providers in such a geographically small place has been a real bonus to us. Co-production and focusing on families. So just as Steve was saying with your relationships with families, you know, I think at a one-to-one level, we really do co-produce therapy and intervention with children and families. I talked briefly before about looking at all of the different clinical outcome systems, and we did spend 2 years going through therapy outcome measures. Is it called therapy? I forget what's Tom's. The different professions have different ones that they use. GAS goals.
Therapy outcome measures.
It is therapy outcome measures. Sorry, I thought I got it wrong then. A range of different off-the-shelf products that different professions and providers were using. What we agreed on in the end was something called the goal-based measure, which is a really simple way of really talking to a family or a young person to get them to identify what's the most important thing for them to work on, and then we progress on that. We've rolled that out for the past few years now across the whole service, and it's another way, I suppose, of families understanding that we are integrated and we're all approaching things together, that every single one of my therapists, be it a physio, an OT, a speech and language therapist, or a dietitian, will approach outcome setting in a collaborative way, and starting with, this is me, so I'm Sarah, I'm a speech and language therapist, what can I do to help you and where do you want to get to? And then using that relationship with balancing the expert nature of the patient, of the parent rather, with the specialist skills of the therapist or professional, and bringing those two together. And all you have on goal-based measure is a 10-point scale. So you would then use your relationship, your therapeutic relationship, to work out what the starting point is, where you want to get to, and what it might look like when you get there. So I think at a individual level, I think we do co-produce. I think care plans are co-produced, and we used a small group of families to set those up a few years ago. What I think we could be much better at doing is co-production of pathways, and we're now on a journey with parents, education, myself for health, our DCO, and social care, to really look at how we develop pathways very much in co-production with families. So we've still got work to do. Ongoing improvements, there's always stuff to improve, isn't there? And I think for us, you know, the ICS work in North Central London is really kind of gathering pace now. I think one of the challenges for Camden will be that when we compare our performance with partners across the sector, we look like we're doing really well, and there can be a little bit of unhelpful, well, it's just because you've had loads of money and that's the only reason you've achieved that. You know, as Amanda was saying at the start, I like to think it's about leadership, and I hope it is, but it's very much about the amount of work that everybody's put in to make this a success and to keep it going and to address challenges collaboratively. And I really hope that we can take some of those principles into the improvements for the sector. But I think that will be our next challenge, really. And on to the next one. So just to refresh, key principles that I think are worth sharing is that having the financial stake was really important to providers. Making shared decisions between providers about where we invest money. So we've had some really good projects, bringing an MSK physio into our health visiting baby hubs, because they can pick up babies with funny heads and funny feet before they need a referral into a service. Didn't cost us very much, but it's, you know, much improved things for families, and it's kept our referrals into services lower. Speech and language therapy into youth offending, you'll all recognise that that's a challenge. We were able to pilot some of that. Key things for performance is having shared responsibility to meet those key performance indicators. There's no finger pointing, you know, you've not done this, it's okay, well, that's not working for you, what can we do to help? We think outcomes have improved, and having us all together means we have some support for more fragile services. So I, for example, I've got 3 days a week of a children's bladder and bowel nurse who does quite a lot of work with our very complex young people and supporting the families. But I can call on my Royal Free acute colleagues to support her development, which means that the outcomes are better rather than just having to keep it local. And the next one. So sharing risk, sharing responsibility for things across the system is, you know, that helps everybody, doesn't it? We're not all having to look at things in silos, and doing that system-wide learning, making things safer. So even if any of you are in a similar position with multiple providers, having a single electronic record that belongs to the child means everybody can see everything that's going on. So we share information. Professional leadership, like I said, everybody gave something up, and you can only be employed by a single provider, and using economies of scale. So we know, for example, we have a number of deaf children, as you all will too, that typically are high need but low numbers. We share the deaf service, the speech and language therapy service, with Islington next door, because Whittington Health provides both. Doesn't make sense for us to develop a whole specialist service here and another one two miles along the way in Islington. So some real benefits of economies of scale there. And I think that's it. Yes.
Thank you very much, Sarah. That was absolutely fascinating. And the minute you mentioned joint records, the chat went wild. And it's something about, there you go, and it's still going wild in terms of that single electronic record system, which I thought was absolutely fascinating. I'm going to steal a question because it's the chair's privilege. I was really interested about, you've got this really incredibly integrated health system, and you can just see again, it's a bit like the work what Rochdale have done, the huge foundations you've had to build that on. Where do you see the role of the local authorities services in terms of social care linking into that, and how does that work with schools? I suppose I was trying to get a feel of a bigger system.
Yeah. So our CYPDS, which is our Children and Young People's Disability Service, the social care element, is co-located with us here, in the building that I'm in today. Obviously not at the moment because social care don't come into the office, but yeah, so for children with disabilities, the social care team is co-located with us here. I guess in terms of school, I was interested in looking at the alliance that is Raising Rochdale. I've got that film in my mind. What was it? What was that child called?
Okay.
And how many academies you have. So I think one of the key things in Camden is we're probably a slightly left-leaning borough. We don't have a single academy convert to primary school in the borough. The primary schools, we do have a new academy, but the primary schools are all maintained and all work very much as a single system with the local authority. And that's where local nuance comes in, doesn't it? So where I'm working with across parents, health, education and social care, the schools are very much part of that body. Our secondary schools are all academies, as I think most secondary schools are. But I think, you know, that probably makes it a lot easier for us. Some of the schools do buy in some additional support, but they're all working very much to the local authority framework.
Okay, thank you. Okay, We've got a few minutes. We're starting to lose people as they move on to their next meetings. But any other questions coming through that would be helpful? Okay, I'm just checking. I think people are doing a lot of absorbing some of the issues that have come through.
Christine,
Yeah.
I think you said Charlotte could ask a question.
I'm sure I must have said Charlotte could ask a question. She was one of the first people who jumped in on electronic records, from what I remember. Charlotte, take the opportunity while you're on the call.
Thank you. I think I've asked a few questions. I'm really interested in the electronic record system. One of my questions was, do you capture goal-based outcomes and measure those and flow that data through your system?
Yeah, so are you familiar with the goal-based measure?
Yeah.
Yeah. So you know, you have, I always laugh if I observe one of my CAMS clinicians talking to a family, they'll have a blank sheet of paper and they'll go, well, we've just got a scale, where are you? If you watch a physio, the physios go, well, what does 1 mean? What does 2 mean? What does 3 mean? They all approach it slightly differently. But yeah, so we use our clinical record is system 1, which isn't as easy to manipulate as something like Rio. And everything needs to be on a template in order for it to be recordable. But in terms of outcoming, the staff, they can record what their goals are if they want to on the template. They don't have to. But for any goal that moves 2 or more points on the scale, we count that as met. And we'd agreed that collaboratively and with commissioning. And then the performance team just pull those off the back end of the system.
That's really, our integrated health provider is moving to system 1 shortly, so that's really good to hear. So I might be back in touch around.
Yeah, we do the same. Really happy to share that. We do the same for shared care plans as well. So there's a box on a template, and if that's ticked, there's a shared care plan in place, which just stops all that awful manual reporting, doesn't it?
Yeah, brilliant, and well done with your figures. Fantastic.
Well, then, you know, some of them aren't as good as they would normally be, but I did want to be honest about it. And you know, the staff in the special school are heartbroken about what's happened this year, but you know, we are where we are, aren't we?
Yeah, thank you.
I think most areas would kill for those figures, Sarah. You know. All right. Amanda, I'm coming back to you.
Are you?
Yes.
Thanks. I'm sorry, but I'm just welling up again. It's just so amazing to we've got the evaluation form there. Thank you, Marie, for putting that up. It is I just think it's so what I love is just hearing the detail of it and going on that journey again. And I think one of the things I think it's really important, especially for Sarah, because she's been doing it for such a long time, I think she forgets what she's achieved actually, which is, you know, absolutely amazing. So I just think it's really nice to and to then help, and when you break it down in that way and you go through the different bits in that way, I just think it then makes it more achievable, you know, for people who are possibly starting on that journey to pick bits off. Especially if you're not in, you know, the areas that I worry about the most are those ones where they don't have that good strategic leadership. And so then just being able to work out, like at your level of management, what is it that you could still achieve, even if you haven't got that sort of real, strategic support underlying you. But I also know that Lorraine will probably want to come in, because I know she's been having some thinking, you know, been having some thoughts from these presentations about some of the things we should be pushing through on the health and care bill, and some of the things that might make their way into her work plan. Lorraine, have I put you on the spot, or would you like to come in?
No, I'm happy to come in. I think I've generated a few other conversations as well, so sorry about that, everyone. But definitely the things that we've discussed on the 2 presentations are very much music to my ears, because it helps me plan ahead and where can I influence. I do think there's something in this joint roles approach, and we maybe need to articulate that a bit better in terms of the impact. So I'll look to take forward some of that understanding in my work with the government departments. But also, I guess, you know, therapies is really, really important. And as Christine mentioned earlier, we've got more work to do. And, you know, some people wouldn't even be able to talk about their data. Some people have not been monitoring their data. So people are in different places. And sometimes it's not about waiting lists, it's about understanding the bigger context and where children are with their outcomes. And I think that is what matters. So I would definitely be taking forward some of this stuff and connecting with people around this. And, you know, CDC colleagues, amazing that you've been supporting colleagues to get on their journeys. I'd like to see more. And how can we do that, I think, is really the next question, because we could have other areas who might not be quite there yet, but they're starting on the journey. Let's be proud of what we've achieved.
And Sarah and Amanda, we wrote up some of Camden's journey, didn't we, as part of a case study, which is a really honest approach as well, Sarah, to your journey. And it's brilliant when people can share things honestly with us and look at what works and what doesn't. And in terms of the work we've been doing to Rochdale, hopefully with Rochdale, sorry, Rochdale, is that also going to be written up into a case study that other people can learn from?
Absolutely. And because we're doing it, so I think Kathy hopefully is still on the call. I know she had to go off earlier and take a call, but Kathy Hamer, who's the Northwest Regional Coordinator, because some of what we've done with Rochdale is through our DFE regional work. We're kind of thinking about how we can pick that up within the region more widely and support them with understanding Rochdale's learning and then sort of what's the word I'm looking, you know, disseminating it out. And obviously one of the great things is that Rochdale's part of GM, so you know, so Charlotte's already doing that as part of her role anyway, so you know, so that works really well. I think Sarah's got her hand up.
It has, I can see.
Thank you. No, I just, it was before you said that, but I think what was really interesting to me is how many analogies there are and common themes that you could really, you know, we could lift out today, couldn't we, from the work Rochdale's doing and the work we're doing, and those then together provide a framework for other people or a menu to choose from, don't they?
Yeah,
absolutely.
And I think one of the things we've learned, building on what Amanda's presentation was earlier, is some of those basic building blocks that have to be in place. That whole sort of stuff around data and information sharing, and that tracks back to Lorraine. You know, if we're going into a local area and they don't know how many children they've got and what they're spending on them and where their needs are and who are responsible for them and what outcomes they want, then we're in trouble. And I suppose one of the things that both of your presentations for me have reflected is that you've done the hard work putting that together. You know, you have got that picture now of where those children are and whatever. And as Lorraine says, that's what's still missing. So one of the things that we're trying to do through CDC and through our contracts with the DFE, and thank you, Catherine, for saying nice things about ours and the NDTI's assistance, is actually work with authorities and local areas to try and build the packages that support that. To sort of give them the toolkit, and that sort of ongoing process, is it not, Amanda?
It absolutely is, Christine. And you might just want to respond to Sam's comment about the autism strategy, because we did say something along those lines.
We did. So the autism strategy came out yesterday. It's recess. Guess what? There's about an announcement today. And we understand that the Cabinet Office strategy for disabled people also comes out next week, though government announcements are variable, but that's when it's due. And these are the frameworks of government. The Cabinet Office strategy that we will make sure you can see focuses a lot on the post-16 transition into employment stuff. The autism strategy, we've said, really is really interesting. That awareness of autism, the diagnostic pathways for autism, that supporting of the workforce, both in schools and social care for autism, is brilliant. And we've said we like it. But actually, what we want to make sure is that all children, regardless of diagnosis, but based on need, also get access to the same levels. So that's what our interest is. That's not to underplay our work with children with autism, because autism takes up a fair amount of our life, but it is about ensuring that all children have good awareness, good diagnosis, good assessment and good intervention. So yes, that was our statement yesterday.
Thank you. And just before you close, Christine, I just do want to say thank you to Sarah and Charlotte and Steve, because they do make it between them a joy to come to work. So thank you, and thank you for giving up your time this morning.
Yes, thank you so much, folks. It is, yeah. Amanda said, come and chair this event, it'll cheer you up. And she was absolutely right. It is so good to see progress. It is so good to work alongside you. So carry on. And Steve, you unwisely at one stage said you hoped you'd be back here next year telling us about where you got to.
I'd love to do that. I'd love to do that, only if you promise to keep working with us.
Oh, we
Yeah.
promised that, and you can register that you've got an invitation. And Helen, thank you for your comments about the meetings are valuable. It's been a weird world over the last 18 months, but we want to keep going and keep these things coming out. And if those of you on the chat and on the audience are also thinking, why are we not having a national webinar on X, and can we have more detail on why, then let us know. We are here to support the fantastic work that you do. That's our role in life. So thanks ever so much for joining us this morning, folks. Have a good day. Please don't forget to fill in the evaluation, because people write really nice things in the chat and then never do the evaluation. So we can't prove to the DFE just how valuable we are. So if you could, that would be great. All right. Thanks ever so much, everyone. Take care.
Thank you.
Bye.
Bye. Leave, yes, leave.